Hello, Saunders County. This is Dr. Hank Newburn at Saunders Medical Center. And in an attempt to try to get the most up-to-date information to you regarding what's going on with the coronavirus and COVID-19 within our communities, we plan on doing a series of short videos, perhaps daily, maybe it's weekly, to try to keep you as best informed with what's going on in our area. To our knowledge, there are no active cases or known cases in Saunders County. There certainly may be people circulating that have had some kind of exposure. Maybe it's a low-level exposure. Maybe they've come in, traveled from some area that did have community widespread cases. Those people are at risk, and that doesn't mean that you need to panic. The main thing is just relax. If you think you have been exposed, we encourage you to call us. Call Saunders Medical Center. We have individuals trained specifically to help walk through your exposure and determine what the level of risk to you is. It's changing constantly. This is something we've not seen before. So bear with us. We are going to do the best care for you that we can based on what is given to us from Three Rivers Health Department, from the State Health Department, and from the Centers for Disease Control. There's lots of misinformation out there. There's a lot of panic out there. There are people out there that are going to want to take advantage of you in these situations. So be careful. If at any time you're concerned, you think something doesn't sound right, contact Saunders Medical Center. We can help you through it. We can tell you what's legitimate and what may not be. But currently, if you feel you're sick or that you've had an exposure, we'd ask that you call 402-443-4191, and we will direct you to somebody to take your information and try to assess your risk as best possible. We are not turning anybody away. If you feel you need to be seen, we have an emergency room open 24 hours a day, 7 days a week with one of our providers available. Our clinics are still open. We may be trying to scale back on some wellness visits, trying to limit exposure to people. But if you do need to be seen, we will see you. We are here for you. We are just trying to mitigate the problem as best possible. So if you have some risk, staying home, trying to avoid exposure to other people, staying 6 feet away from people that might be sick, what they refer to in the news as social distancing is going to be important. If you have a known exposure, we may want you to stay home, monitor your temperature, and watch for signs of infection. If you develop signs of infection, you contact us and we'll direct you further. So first and foremost, try to contact us. We will help you through this. But if at any time you feel you need to be seen, we are here for you to provide that care. In the coming weeks, we anticipate that COVID-19 and coronavirus cases are going to increase. And there are populations that are at particularly high risk. Those with ongoing health problems such as heart disease, lung disease, maybe diabetes or kidney disease. So those people need to take special precautions to limit their exposure. Washing hands, don't touch your face, washing surfaces down, keeping sick people out of your home and staying home. If you need assistance, contact Saunders Medical Center. We will try to get assistance for you in any way we can. But to protect our medical healthcare force here at Saunders, because we are particularly susceptible to this, we are going to be exposed, and studies are showing that healthcare workers do worse with this COVID-19. So in an attempt to limit exposure to some of our employees are over 50, they're over 60. Some of our providers, I am almost 53 years old. I'm in a a higher risk group, a moderate risk group, but certainly any of our providers or our employees that are over 60 years old, regardless of what their health is, are at particularly high risk of complications related to COVID-19. So we are taking measures in cooperation with those employees because they are concerned about their health as well, and we are looking out for their wellness as best we can. There may come a time where we and themselves restrict exposure to people with respiratory illnesses. It may come to that, and it's not that we are trying to push anybody out. We're not trying to get rid of any employees or providers. It's quite the opposite. We are taking measures to ensure their safety, and I can assure you they are appreciative of our efforts and our concern for their health because they are in a higher risk group. So this is going to be the first of the videos. Hopefully we'll get different providers involved, but rest assured, we are doing our best to follow national, state, and regional guidelines as far as management of COVID-19. And we are here to provide the best care we can for you. Thank you.